The Office of National Drug Control Policy is a component of the executive branch of the President. The mission of the ONDCP is to reduce substance use disorder and its consequences by coordinating the nation's drug control policy through the development and oversight of the National Drug Control Strategy and Budget. The ONDCP was established by the Anti-Drug Abuse Act of 1988. The Office of National Drug Control Policy leads and coordinates the nation's drug policy so that it can best improve the health and lives of the American people. The ONDCP accomplishes this through developing and overseeing the implementation of the National Drug Control Policy. They use the latest evidence and research to promote public health and public safety approaches that address substance use disorder, reduce the consequences associated, and help Americans recover from substance use disorder. Secondly, they are responsible for developing and overseeing the implementation of the National Drug Control Budget. Through the budget, the ONDCP aligns funding and resources for 16 federal government agencies and departments. Third, they administer high-intensity drug trafficking areas and drug-free communities grants. The current leader of this organization is the Honorable James W. Carroll. He has led this agency since his appointment in 2019. I submitted a few different FOIAs to different agencies, but I was most pleased with my response from the ONDCP, not necessarily because of the information given, but because they responded so quick and on official documentation. Here you can see. I asked the pretty basic question, how many pounds of illegal narcotics were confiscated in 2020? They responded a week later saying that agencies are not required to answer questions posed as FOIA requests. If you wish to pursue your request, please provide a detailed description of the particular records you are seeking. They basically said my question was too vague. They also suggested that I reach out to the Department of Justice and Drug Enforcement Administration and provided contact details. This year, President Biden and Vice President Harris announced their drug policy priorities for year one. The first of 6 priorities is expanding access to evidence-based treatment to help those with substance disorders and to help get rid of the stigma behind it. Their second priority is advancing racial equity in our approach to drug policy. Their third priority is enhancing evidence-based harm reduction efforts. Harm reduction organizations provide a key engagement opportunity between people who use drugs and healthcare systems. Their fourth priority is supporting evidence-based prevention efforts to reduce youth substance use. Their fifth priority is reducing the supply of illicit substances. And finally, their last priority is advancing recovery-ready workplaces and expanding the addiction workforce. You can find this briefing on whitehouse.gov, and it goes deeper into all of these goals and how they want to achieve them. The most recent drug use statistics come from 2020 when the CDC released the final data on drug overdose deaths for 2019 in the United States. The report showed an overall increase in drug-related poisonings. The data also showed a continued decrease in opioid-related overdose deaths. Overdose deaths involving specific prescription opioids declined 5% in 2019 compared to 2018. The leader of this organization works closely with the president and vice president. The ONDCP makes decisions and changes rules every year, using data from the previous year to guide their decisions. They develop and submit to Congress a national drug control strategy. They then coordinate and oversee the implementation of this strategy by federal drug control agencies and annually assess and reissue this strategy, taking into account the previous year's experience. The street-level bureaucrats of the ONDCP are the 16 federal agencies and departments that receive their funding and direction from the Office of National Drug Control Policy. They do not have that much discretionary power, as they must follow the laws and policies implemented by the ONDCP. Does the agency do what it was originally designed to do? Yes, it does. It is effective by doing lots of research every year to ensure the policy in place is well thought out and addresses the country's current needs. The consequences of eliminating this agency would leave the drug enforcement of the country without a goal or singular head entity to organize these policies across the country. People who struggle with addictions would be left without resources, and policies would be useless. Thank you.